Explain the key principles of high reliability organizations, HRO, in healthcare. How do these principles contribute to the reduction of medical errors and improvement of patient safety? Answer: high reliability organizations, HROs, are organizations that operate in complex, high risk environments but manage to maintain a high level of safety and reliability. The key principles of HROS in healthcare include preoccupation with failure. HROS consistently focus on identifying potential problems before they manifest into failures. This proactive approach allows healthcare systems to reduce medical errors by addressing small issues early on. Reluctance to simplify. HROS avoid simplifying complex healthcare processes. They recognize that simplifying systems can lead to the overlooking of critical variables that could result in safety risks. Sensitivity to operations. HROS prioritize constant monitoring of operational performance, encouraging vigilance and attention to details. This sensitivity helps in detecting safety threats that may arise in real time. Commitment to resilience. HROS develop adaptive capacity to respond to unexpected events or failures in systems. The ability to recover quickly from problems ensures minimal harm to patients. Deference to expertise. In an HRO, decision-making is guided by the expertise of those most familiar with the problem at hand, regardless of their rank or position. This approach fosters a culture of collaboration and shared responsibility. Contribution to patient safety. By embedding these principles, HROS minimize the occurrence of adverse events, promote error reporting, and create an environment where safety concerns are addressed before they escalate into incidents. For instance, in a hospital setting, these principles could lead to better communication during patient handovers, preventing common sources of errors. What are the steps involved in conducting a root cause analysis, or CA, in healthcare? Why is identifying the root cause rather than just the symptoms crucial in preventing future adverse events? Answer: root cause analysis, or CA, is a systematic process for identifying the underlying causes of adverse events or near misses in healthcare. The steps involved in conducting an RCA are as follows: data collection. Gather all relevant information about the incident, including patient records, staff interviews, and equipment logs. Timeline construction. Create a detailed timeline of the events leading up to the incident, mapping out key actions, decisions, and conditions. Cause identification. Analyze the incident to identify direct and contributing causes. This is typically done using tools like the 5 Whys or fishbone diagrams, Ishikawa diagrams, to systematically explore the chain of events and their origins. Root cause identification. Identify the root cause S of the incident, which are often systemic issues rather than isolated events. This could involve inadequate training, poor communication, equipment failure, or policy gaps. Develop actionable solutions. Based on the root causes, develop corrective and preventive actions that address both the immediate issue and the underlying system flaws. Implementation and follow-up. Implement the solutions and continuously monitor their effectiveness to ensure that they prevent the recurrence of similar incidents. Why root cause matters. Identifying the root cause rather than just addressing the symptoms is crucial because it helps prevent future incidents. Addressing only the symptoms might lead to temporary fixes without solving the underlying systemic issues. For example, if an error in medication administration is due to a lack of staff training on drug protocols, simply increasing staff awareness of that specific drug will not resolve the broader training deficiency, and future errors could still occur. What is the failure mode effects analysis, FME, and how does it contribute to proactive patient safety strategies in healthcare settings? Answer: failure mode effects analysis (FME) is a structured approach to identifying and addressing potential failures in a process before they occur. In healthcare, it is often used to proactively assess the risk of failure in clinical processes, equipment, and systems. Steps involved in FME: define the scope, clearly identify the process or system to be analyzed, e.g., medication administration process, surgical procedures. Identify failure modes. List all possible failure modes, ways a process can fail within the system. For example, in medication administration, potential failures could include wrong drug selection, incorrect dosage, or improper timing. Determine the effects. For each failure mode, identify the potential effects on patient safety, such as adverse drug reactions or complications from incorrect procedures. Assess risk. Assign a risk priority number, RPN, to each failure mode based on its likelihood, severity, and ability to detect it. Contribution to patient safety. FME helps healthcare organizations identify and mitigate risks before they lead to harm, making it a powerful tool in preventing adverse events. By proactively addressing vulnerabilities, healthcare facilities can prevent patient safety issues related to system failures, medication errors, and equipment malfunctions. Mr. Williams, a nurse in a busy hospital ward, witnesses a medication error when a colleague administers the wrong dosage of a critical medication to a patient. Although no immediate harm occurs, Mr. Williams is unsure whether he should report the incident. What should Mr. Williams do according to best practices in safety reporting systems? Answer: according to best practices in safety reporting systems, Mr. Williams should report the medication error even if no immediate harm occurred. The primary goal of safety reporting systems is to capture and address potential risks before they lead to adverse outcomes. The incident should be documented in the hospital's incident reporting system with an emphasis on identifying the cause of the error, e.g., miscommunication, distraction, or lack of knowledge, and mitigating factors. Key principles to consider include non-punitive reporting. A culture of non-punitive reporting ensures that staff members feel safe to report errors without fear of retribution. This encourages transparency and fosters continuous learning. Timeliness. Incidents should be reported as soon as possible to prevent recurrence and to allow for swift corrective actions. Learning from errors. Even if no harm occurred, the incident provides an opportunity to identify vulnerabilities in the system and improve patient safety measures. The hospital should have established protocols that ensure every reported event is reviewed, root causes are identified, and corrective actions are implemented. Describe the process of risk identification and assessment in healthcare. How do quantitative and qualitative approaches complement each other in the overall risk management process? Answer: risk identification and assessment are critical steps in healthcare risk management to ensure patient safety. The process typically involves the following steps. Risk identification. The first step is to identify potential risks that could harm patients. This can be done through audits, incident reports, staff interviews, patient feedback, and environmental scans. Tools like FMEA and RCA may be used to uncover latent risks. Risk assessment. Once risks are identified, they are assessed for their likelihood, impact, and severity. The assessment can be done using both quantitative and qualitative approaches. Quantitative risk assessment. This approach uses numerical data to calculate the likelihood and impact of risks. Statistical models, such as probability analysis or Monte Carlo simulations, are employed to predict outcomes based on historical data. For example, a quantitative model may assess the likelihood of medication errors based on past reports and calculate the expected patient harm. Qualitative risk assessment. This approach relies on subjective judgment and expert input to evaluate risks. Risk matrices or scoring systems may be used to categorize risks based on their severity and likelihood. For instance, a qualitative assessment could involve discussing possible failure points in surgical procedures and assessing their risk through expert consensus. Complementary nature. Quantitative methods provide a data-driven approach that allows healthcare organizations to prioritize risks based on empirical evidence. On the other hand, qualitative methods provide valuable insights into risks that may not be fully captured by data, such as human factors or systemic inefficiencies. Together, these approaches offer a comprehensive view of potential threats to patient safety and help guide mitigation strategies. What are some common risk mitigation strategies used in healthcare settings, and how do they contribute to the overall improvement of patient safety? Answer: risk mitigation strategies are essential in preventing and reducing the impact of potential risks in healthcare. Some common strategies include standard operating procedures, SOPs, establishing clear and consistent procedures for critical tasks, such as medication administration, reduces variability and minimizes errors. Staff training and education. Ongoing training ensures that healthcare professionals are updated on the latest safety protocols, best practices, and regulations, which helps prevent mistakes and promotes high-quality care. Technology and automation. Using technology such as electronic health records, as automated medication dispensing systems, and barcode scanning reduces human errors and enhances the accuracy of care delivery. Teamwork and communication. Encouraging effective communication through tools like handoff protocols or the SBAR, situation, background, assessment, recommendation technique ensures that critical information is shared clearly and accurately. Error reporting and feedback systems. Reporting mechanisms allow staff to report incidents and near misses, which can be analyzed to identify trends and prevent future occurrences. The feedback loop ensures that staff members are informed about the corrective actions taken. Regular audits and reviews. Frequent audits of clinical processes and outcomes help detect potential risks early, ensuring that issues are addressed proactively. Contribution to patient safety. By implementing these strategies, healthcare organizations can reduce the likelihood of adverse events and enhance overall patient safety. These approaches help build a culture of safety where staff are empowered to report issues, learn from mistakes, and continuously improve care quality. Explain the importance of incident response and communication strategies in healthcare. How can effective communication minimize the impact of adverse events? Answer: incident response and communication strategies are critical in managing adverse events in healthcare. When an incident occurs, swift, transparent, and accurate communication is key to minimizing harm and ensuring a swift resolution. Key elements of effective incident response include immediate response. Quickly addressing the incident and mitigating any immediate risks to patient safety is the first priority. This could involve stabilizing the patient, halting a harmful procedure, or securing the affected area. Clear communication. Communication among the healthcare team should be clear and structured, ensuring that everyone involved is aware of the incident and their responsibilities. Transparency with patients and families. It is essential to communicate openly with patients and their families about the incident, its potential consequences, and the steps being taken to prevent recurrence. This builds trust and reduces the risk of litigation. Post-incident analysis. After the incident, a thorough analysis should be conducted to understand the cause, and corrective actions should be implemented. Communication during this phase involves sharing findings and improvements with staff to prevent similar incidents. What are some common patient safety risk factors in healthcare, and how can healthcare organizations address these to reduce harm? Answer: patient safety risk factors are conditions or circumstances that increase the likelihood of harm to patients. Common risk factors include human factors. Errors related to human behavior, such as fatigue, stress, and lack of training, can lead to mistakes in diagnosis, medication administration, or procedures. Environmental factors. Poor lighting, cluttered workspaces, and inadequate facilities can increase the risk of errors. For example, staff may have difficulty accessing emergency equipment in a disorganized environment. Communication breakdown. Ineffective communication between healthcare providers can lead to misunderstandings, misdiagnoses, or improper treatments. For instance, unclear handoffs between shifts can result in critical information being overlooked. Medical equipment and technology. Malfunctioning or outdated medical equipment or improperly trained staff in using technology can compromise patient safety. This includes issues like incorrect drug dosages from automated systems or inadequate sterilization of surgical instruments. Patient factors. Certain patients may have unique needs or vulnerabilities, such as elderly patients with cognitive impairment or patients with multiple comorbidities. These factors may increase the complexity of care and the risk of adverse events. Addressing these risks. Healthcare organizations can address these risks by implementing robust training programs, improving communication protocols, maintaining up-to-date medical equipment, fostering a culture of safety, and ensuring that staff are properly supported to mitigate fatigue and stress. Why is it important to classify and categorize safety events in healthcare, and what are some common classification systems used in patient safety? Answer: classifying and categorizing safety events allows healthcare organizations to understand the nature and severity of incidents and take appropriate corrective actions. It helps in identifying trends, allocating resources effectively, and targeting areas for improvement. Common classification systems include severity levels. Events are classified by their severity, ranging from no harmy, G. near miss, to catastrophic harmy, G. patient death. This allows organizations to prioritize incidents that require immediate attention. Event types. Categorizing events by type, such as medication errors, falls, or surgical errors, helps identify recurring problems in specific areas and target interventions. Root cause classification. Events can also be categorized by the root cause, e.g., human error, system failure, equipment malfunction, providing insight into systemic weaknesses. By classifying events, healthcare organizations can develop targeted strategies to improve patient safety and prevent recurrence of similar incidents. Compare and contrast quantitative and qualitative risk analysis methods. How can both be used together to create a more comprehensive risk management plan? Answer: quantitative and qualitative risk analysis methods are complementary approaches used in healthcare risk management. Quantitative risk analysis involves the use of numerical data to assess the likelihood and impact of risks. Methods like statistical modeling, probability analysis, and cost-benefit analysis provide objective, data-driven insights into risk severity and likelihood. Qualitative risk analysis relies on subjective judgment, expert opinion, and stakeholder input. Techniques like risk matrices, SWOT analysis, and brainstorming sessions help identify and prioritize risks based on expert consensus and qualitative data. Both methods work together by providing a holistic view of risks. Quantitative analysis offers precise numerical assessments, while qualitative analysis adds context and insight based on experience and professional judgment. Together, they form a more complete risk management plan, enabling healthcare organizations to address both measurable risks and complex, subjective factors that affect patient safety. Explain the relationship between patient safety and the quality of care in healthcare settings. How do these two concepts influence each other in terms of improving healthcare outcomes? Answer: patient safety and quality of care are closely linked, but they are distinct concepts. Patient safety focuses specifically on preventing harm to patients, including adverse events like medication errors, infections, or falls. Quality of care, on the other hand, encompasses a broader perspective that includes patient outcomes, effectiveness of treatments, patient satisfaction, and efficiency in care delivery. The relationship is symbiotic. Improving patient safety directly contributes to the overall quality of care. For example, preventing medication errors, patient safety can result in better therapeutic outcomes, reducing hospital readmissions and improving patient satisfaction, all of which are indicators of high-quality care. Healthcare organizations that emphasize patient safety often have more robust quality improvement initiatives, as safe environments foster better clinical practices, enhance patient outcomes, and improve operational efficiency. For example, a hospital with a culture of safety will likely also focus on standardized care protocols that ensure consistent and high-quality treatment across patient populations. What are the key principles of patient safety culture in healthcare organizations, and how can they be assessed and improved over time? Answer: patient safety culture refers to the shared values, beliefs, and behaviors within a healthcare organization that influence safety practices and attitudes toward patient safety. The key principles of patient safety culture include leadership commitment. Leadership must prioritize patient safety, allocate resources, and set the tone for a culture of safety. Teamwork and communication. Open communication among healthcare professionals is essential for identifying potential hazards and preventing errors. Non-punitive reporting system. Encouraging the reporting of safety incidents without fear of punishment allows organizations to learn from mistakes and continuously improve. Patient involvement. Involving patients in their own care planning and decision-making can increase safety, continuous learning, and improvement. Healthcare providers should constantly evaluate safety data, identify patterns, and adapt practices based on findings. To assess and improve safety culture, tools such as the Safety Attitudes Questionnaire, SAQ, and the AHRQ Hospital Survey on Patient Safety Culture are used. How do regulatory and accreditation standards like those set by the Joint Commission (EJC) and CMS influence patient safety practices in healthcare settings? Answer: regulatory and accreditation standards play a critical role in establishing and enforcing patient safety practices within healthcare organizations. The Joint Commission, a leading accreditation body, sets standards that healthcare organizations must meet to achieve accreditation, including requirements for safe patient care practices such as medication management, infection control, and fall prevention. Compliance with TJC standards ensures that organizations follow evidence-based practices that minimize risks to patients and improve care outcomes. Similarly, the Centers for Medicare and Medicaid Services (CMS) implements regulations that directly affect patient safety, including requirements for reporting and addressing hospital-acquired conditions, HACs like surgical site infections and catheter-associated urinary tract infections. Non-compliance with these regulations can result in penalties or loss of funding, which further incentivizes hospitals to focus on patient safety. Both TJC and CMS have specific frameworks like the National Patient Safety Goal (EPDS) that set measurable benchmarks for key safety areas such as infection prevention, safe surgery practices, and the correct administration of medications. Mr. Williams, a hospital administrator, is noticing a growing number of medication errors reported by nursing staff. He wants to create an action plan to address this issue. What steps should Mr. Williams take to improve medication safety in his hospital, and how can he involve the nursing staff in this process? Answer: Mr. Williams should take a systematic approach to addressing medication errors, using both organizational strategies and input from nursing staff. The steps should include root cause analysis (RCA). Begin by conducting an RCA to identify the underlying causes of the medication errors. This will help understand whether errors are related to communication breakdowns, inadequate training, system inefficiencies, or environmental factors. Review medication management systems. Assess the hospital's medication management policies, including prescription, dispensing, administration, and monitoring practices. Introduce or enhance computerized physician order entry (CPO) systems to minimize errors due to illegible handwriting or incorrect dosage instructions. Standardized protocols. Develop and implement standardized medication administration protocols. This could include double-checking high-risk medications, implementing barcode medication administration (BCMA) technology, and ensuring that all staff are trained on new procedures. Staff involvement. Engage the nursing staff in this process by conducting focus groups or surveys to gather their input on existing barriers and challenges. Encourage open reporting and create a non-punitive environment for discussing errors. Education and training. Implement regular training sessions for nurses and other healthcare staff on medication safety, including techniques for identifying potential errors before they occur. Encourage ongoing learning about pharmacology, drug interactions, and the proper use of medical technology. Continuous monitoring. Establish ongoing performance monitoring and audits to track medication error rates and ensure the action plan's effectiveness. This can include reviewing error reports, conducting chart audits, and evaluating the success of interventions. By addressing the root causes of errors and involving nursing staff in the improvement process, Mr. Williams can significantly reduce medication errors and improve patient safety. What is the role of the Institute for Healthcare Improvement (IHI) in advancing patient safety, and what framework does it offer for healthcare organizations to reduce harm and improve care outcomes? Answer: The Institute for Healthcare Improvement (IHI) is a key player in advancing patient safety through its promotion of evidence-based practices and continuous improvement initiatives. IHI focuses on reducing patient harm and improving care outcomes by offering several frameworks and tools that healthcare organizations can adopt. One of the most widely recognized frameworks is the IHI Triple Aim, which aims to improve the patient experience of care, including quality and satisfaction, improve the health of populations, reduce the per capita cost of healthcare. IHI also offers the IHI Global Trigger Tool, a method used to identify adverse events and errors through chart reviews. This tool helps organizations track patient safety issues and identify areas where harm is occurring. Additionally, IHI's 100,000 Lives campaign and 5 Million Lives campaign have helped raise awareness and implement strategies to prevent common patient safety problems such as hospital-acquired infections, preventable surgical complications, and medication errors. What is the significance of the National Patient Safety Goal (EPIDS) developed by the Joint Commission, and how do these goals help healthcare organizations improve patient safety? Answer: The National Patient Safety Goals (EPIDS) developed by the Joint Commission are a set of specific, evidence-based guidelines designed to address critical patient safety challenges in healthcare settings. The NPSGS focus on preventing harm and improving safety in key areas such as medication management, infection control, and surgical safety. Examples of NPSGS include medication safety, ensuring accurate medication reconciliation and reducing errors related to high-alert medications. Infection prevention, promoting hand hygiene, use of sterile techniques, and appropriate antibiotic stewardship to reduce healthcare-associated infections, highs. Surgical safety, implementing preoperative verification processes and surgical checklists to prevent wrong site, wrong procedure, and wrong patient surgeries. By focusing on these areas, NPSGS help healthcare organizations adopt best practices, standardize care processes, and create a safer environment for patients. Compliance with NPSGS is required for accreditation, and hospitals that meet these standards are likely to see improvements in patient outcomes and reductions in preventable harm. How can healthcare organizations ensure compliance with the Centers for Medicare and Medicaid Services (CMS) regulations related to patient safety, and what consequences might arise from non-compliance? Answer: Healthcare organizations must ensure compliance with CMS regulations by implementing rigorous safety protocols and participating in CMS-sponsored programs such as the Hospital Acquired Conditions (HAC) initiative and the Hospital Value-Based Purchasing (VBP) program. Key strategies for compliance include monitoring and reporting. Organizations must track specific patient safety metrics, including infection rates, adverse events, and remission rates, and submit this data to CMS for review. Staff training. Regular staff education on CMS regulations and patient safety standards is essential. Healthcare providers should be trained to follow proper documentation practices and evidence-based safety protocols. Quality improvement initiatives. Implement continuous quality improvement. CCI programs that focus on addressing identified safety issues. This can involve process redesign, technology adoption, and collaborative care. Strategies to prevent adverse events. Internal audits. Conduct internal audits to assess compliance with CMS regulations and identify areas for improvement. Non-compliance with CMS regulations can result in financial penalties, reduced reimbursement rates, or even exclusion from Medicare and Medicaid programs. This can significantly impact a healthcare organization's finances and reputation. What is the purpose of the root cause analysis (OCA) process in patient safety, and how does it differ from failure mode effects analysis (FME) in identifying and addressing safety risks? Answer: Root cause analysis (OCA) is a systematic approach used to identify the underlying causes of adverse events or near misses in healthcare. RCA focuses on investigating individual incidents in detail to determine the root cause and recommend corrective actions to prevent recurrence. This process is typically reactive, conducted after an adverse event occurs. On the other hand, failure mode effects analysis (FME) is a proactive approach that identifies potential failures in processes before they happen. FME systematically evaluates processes to anticipate where failures might occur, assigns risk priority numbers (RPNs) based on severity, occurrence, and detectability, and then takes steps to reduce or eliminate these risks. The key difference is that RCA is reactive, conducted after the fact, and aims to fix immediate issues, whereas FME is proactive and aims to prevent future problems by addressing potential risks in processes. Ms. Johnson, a nurse, notices that there have been multiple reports of patient falls in her hospital's long-term care unit. She suspects that inadequate staffing and unclear fall prevention protocols may be contributing factors. What steps should she take to address the issue? Answer: Ms. Johnson should take the following steps to address the issue of patient falls. Report the concern. First, Ms. Johnson should report her observations to hospital leadership and the Patient Safety Committee. By formalizing the concern, it ensures that the issue is recognized at the institutional level. Conduct a risk assessment. Work with the healthcare team to conduct a full risk assessment for patients in the unit, including environmental factors like lighting and bed height, as well as clinical factors like mobility issues and medication side effects. Review and update protocols. Collaborate with other healthcare providers to review and revise the hospital's fall prevention protocols. This may include adding new safety measures like non-slip socks, bed alarms, or scheduled rounding. Improve staffing levels. Advocate for increasing staffing levels to ensure that patients are adequately monitored, especially those at higher risk for falls. Staff education. Educate the nursing staff on the importance of fall prevention strategies and the need for consistent implementation of protocols. What is the role of patient safety officers in healthcare organizations, and what specific responsibilities do they have in improving safety and ensuring compliance with regulatory standards? Answer: Patient safety officers play a critical role in promoting a culture of safety within healthcare organizations. Their responsibilities include monitoring patient safety metrics. Patient safety officers track and report on key performance indicators, KPIs, such as medication errors, infection rates, and patient harm incidents. Developing safety protocols. They are responsible for developing, implementing, and ensuring compliance with safety protocols and best practices. Leading root cause analysis (RCA). They lead investigations into adverse events and near misses using RCA techniques to identify root causes and recommend corrective actions. Training and education. Patient safety officers oversee education and training programs for staff on patient safety practices, regulatory requirements, and incident reporting. Compliance with regulations. They ensure compliance with regulatory standards set by bodies such as the Joint Commission (EJC) and CMS, including preparing for accreditation surveys and audits. Promoting safety culture. They lead initiatives to improve the organization's safety culture, such as implementing a non-punitive error reporting system and fostering open communication about safety concerns. What is the primary distinction between a just culture and a blame culture in healthcare, and why is it important for patient safety? Answer: A just culture is a safety culture that balances accountability with learning from mistakes, focusing on understanding the root causes of errors rather than punishing individuals for unintentional mistakes. This approach encourages open reporting, reduces fear of retribution, and fosters an environment where healthcare professionals can discuss errors and near misses without fear. It recognizes that human error is inevitable, but also provides mechanisms to identify systems or processes that can be improved to prevent future incidents. In contrast, a blame culture involves punishing individuals for errors, often without considering systemic factors. This creates an atmosphere of fear and discourages reporting of errors, ultimately undermining patient safety efforts. The importance of a just culture lies in its potential to foster transparency and continuous improvement, which are crucial for enhancing patient safety. For instance, according to the National Patient Safety Foundation's Just Culture model, focusing on system improvement can prevent future errors, whereas the punitive approach often leads to underreporting, which may miss opportunities to learn and improve. Explain the role of leadership in promoting patient safety within a healthcare institution and describe the actions leaders must take to establish a strong safety culture. Answer: leadership plays a critical role in fostering a culture of patient safety by setting the tone for safety practices, ensuring that safety is prioritized at all levels, and providing the necessary resources for safety initiatives. Leaders must commit to a clear safety vision. Senior leaders should articulate and demonstrate their commitment to safety by integrating patient safety into the institution's core mission and values. This includes setting measurable goals for safety and holding all staff accountable for safety standards. Encourage open communication. Leadership must create an environment where staff feels comfortable reporting safety concerns without fear of retribution. This can be achieved by leading by example and being transparent about safety issues within the organization. Foster teamwork and collaboration. Leaders should promote interprofessional collaboration, ensuring that different healthcare teams, nurses, physicians, allied health professionals work cohesively to address patient safety concerns. Provide training and resources. Leaders must allocate appropriate resources and training opportunities to equip healthcare professionals with the skills necessary to recognize and mitigate safety risks. How do cognitive biases affect decision-making in healthcare, and what steps can healthcare systems take to mitigate their impact on patient safety? Answer: cognitive biases are systematic patterns of deviation from normal rationality and judgment where healthcare professionals may make decisions based on subjective preferences or past experiences rather than objective analysis. In healthcare, common cognitive biases include anchoring bias, where a clinician's decision is overly influenced by initial information or diagnosis, leading them to ignore subsequent data that contradicts the initial diagnosis. Confirmation bias, when clinicians focus on evidence that supports their initial diagnosis or hypothesis, disregarding contradictory evidence. Availability bias, when clinicians rely on the most readily available information or recent experiences, rather than considering a broader range of possibilities. These biases can lead to diagnostic errors, inappropriate treatment plans, and delayed interventions, ultimately compromising patient safety. To mitigate these biases, healthcare systems can implement decision support tools. These can provide evidence-based recommendations that challenge assumptions and encourage a more balanced decision-making process. Encourage second opinions and collaborative decision-making. Creating a culture of teamwork and open discussion can help uncover errors in judgment and reduce reliance on individual biases. Promote awareness and training. Educating healthcare professionals about common cognitive biases and their effects on decision-making can reduce their impact. Research from the Institute of Medicine highlights that addressing cognitive biases is essential for reducing diagnostic errors, which are a significant source of patient harm. Mr. Kato is a nurse in a busy hospital ward. He notices that a colleague, Nurse Jessica, frequently skips the final step of the patient safety checklist before administering medications, citing time constraints. Mr. Kato is concerned about the potential risks to patient safety, but he is unsure whether to report this behavior, as Nurse Jessica is highly regarded by other staff members. What should Mr. Kato do in this situation? Answer: Mr. Carter should report the issue to ensure patient safety, even if it feels uncomfortable. In a healthcare setting, patient safety is paramount, and skipping steps in critical processes like medication administration can lead to severe consequences, such as medication errors. Under the principles of just culture, healthcare professionals are encouraged to report safety concerns, not as a means of punishing individuals, but to identify potential risks and improve systems. Mr. Carter should approach Nurse Jessica with the concern directly to understand the context, e.g., whether time pressures are contributing to the behavior, and if the behavior persists or remains unaddressed, he should escalate the matter to a supervisor or patient safety officer. This action is aligned with patient safety guidelines outlined in the Joint Commission's National Patient Safety Goals, which emphasize adherence to standardized safety protocols to prevent avoidable harm. What are the key elements of human error, and how can healthcare systems design processes to minimize the risk of human error in patient care? Answer: human error in healthcare can be categorized into three main types: Slips. These are unintentional mistakes that occur during routine tasks, often due to lapses in attention or distractions, e.g., administering the wrong dose of medication. Lapses. These are errors of omission, such as forgetting to complete a critical step in a patient's care plan. Mistakes. These occur when the wrong decision is made due to incorrect knowledge or misapplication of expertise, e.g., diagnosing a patient with the wrong condition based on incomplete information. To minimize human error, healthcare systems can implement standardization of procedures, using checklists, protocols, and standardized workflows to reduce variability and prevent lapses or mistakes. Automation and technology. Implementing electronic health records (EHR) and computerized physician order entry (CPOE) systems to reduce the reliance on manual data entry and decrease the likelihood of slips. Training and simulation. Providing ongoing training and simulation exercises to improve clinicians' skills, attention to detail, and response to high-pressure situations. How do environmental factors such as lighting, noise, and workspace design impact patient safety, and what can healthcare organizations do to optimize the physical environment for safety? Answer. Environmental factors play a significant role in patient safety as they can affect healthcare providers' ability to perform tasks accurately and safely. Lighting. Inadequate or improper lighting can contribute to visual errors, such as misreading patient records or administering incorrect medication. Noise. High levels of noise in healthcare environments can impair communication, increase stress, and lead to mistakes during critical tasks like surgery or medication administration. Workspace design. Poorly designed workspaces can lead to inefficient workflows, increases in physical strain, and distractions that interfere with concentration and patient care. To optimize the physical environment, healthcare organizations can design workspaces with ergonomics in mind, ensuring that clinicians have easy access to tools and information and can work efficiently without unnecessary physical strain. Implement noise reduction strategies, use noise-absorbing materials, quiet zones, and limit unnecessary overhead announcements to reduce distractions. Improve lighting, ensure that work areas, such as medication preparation areas and operating rooms, are well lit to reduce errors related to visual perception. What is the relationship between teamwork and patient safety, and what strategies can be implemented to improve collaboration among healthcare teams? Answer. Effective teamwork is essential for patient safety as it ensures that healthcare professionals from various disciplines can communicate effectively, share relevant information, and collaborate to deliver optimal care. Poor teamwork, on the other hand, can lead to communication failures, errors in patient handoffs, and delays in care, all of which increase the risk of harm to patients. Strategies to improve collaboration include structured communication protocols, implementing standardized communication tools such as SBAR, Situation Background Assessment Recommendation, to ensure that important patient information is conveyed accurately and efficiently. Regular team training, providing team-based simulations and training to enhance team dynamics, role clarity, and problem-solving skills in high-pressure situations. Encourage cross-disciplinary teamwork, creating opportunities for different professional groups, e.g., doctors, nurses, technicians, to collaborate and understand each other's roles in the care process. What is the role of human factors engineering in patient safety, and how can healthcare systems apply principles of human factors to design safer systems? Answer. Human factors engineering focuses on optimizing the design of systems, tools, and environments to align with human capabilities and limitations. It aims to reduce the likelihood of human error by designing systems that are intuitive, easy to use, and minimize cognitive overload. In healthcare, this involves designing user-friendly medical devices, ensuring that equipment such as infusion pumps are easy to use with clear interfaces and alarms that reduce the risk of misoperation, simplifying processes and workflows, creating straightforward, streamlined workflows that reduce the likelihood of mistakes and ensure that critical steps are not overlooked, providing appropriate feedback, implementing systems that provide immediate, clear feedback when errors occur, e.g., audible alarms, visual cues to help staff respond quickly according to the human factors and ergonomic society. Healthcare organizations that apply human factors engineering principles see a significant reduction in medical errors, enhancing patient safety. Why is it important to involve patients and families in patient safety efforts, and how can healthcare organizations engage them in the process? Answer. Involving patients and families in patient safety efforts is critical because they can act as an additional layer of safety, offering valuable information about the patient's condition, preferences, and potential risks. Furthermore, when patients and families are engaged, they are more likely to ask questions, clarify instructions, and advocate for safe care, which can help prevent errors. Healthcare organizations can engage patients and families by encouraging open communication, ensuring patients and families are informed about their care plans and feel empowered to ask questions and report concerns, involving them in safety planning, including patients and families in safety rounds or care team meetings where they can provide input into the care process. Patient education. Providing patients with clear information about their treatment options, medications, and potential risks, allowing them to make informed decisions and participate actively in their care. The Institute for Patient and Family-Centered Care advocates for involving patients and families as partners in care to improve safety and quality outcomes. What strategies can be implemented to create a safety reporting environment where staff feel comfortable reporting adverse events and near misses? Answer: creating a safety reporting environment is critical for identifying risks and preventing future errors. Strategies to foster such an environment include ensuring confidentiality. Staff must be assured that their reports will be kept confidential to prevent retaliation and protect their privacy. Promoting a non-punitive approach. Organizations must focus on learning from mistakes rather than assigning blame. This can be supported by a just culture framework. Providing feedback. It's important to provide feedback to staff on the outcomes of their reports, demonstrating that their contributions are valued and lead to positive changes in safety practices. Making reporting easy. Implementing simple and accessible systems for reporting errors, such as online forms, phone hotlines, or even anonymous reporting options. The National Quality Forum emphasizes that an effective reporting system is essential for improving patient safety and ensuring continuous improvement in healthcare environments.